from St. Louis Public Radio. This is Politically Speaking. Hi, everybody. This is Jason Rosenbaum, a political correspondent with St. Louis Public Radio. Missouri child abuse investigators missed warning signs of fentanyl use among parents before their young children died of accidental overdoses from the drug, according to a startling new state report. This finding is raising sharp questions about the management of Children's Division, an agency that's faced daunting challenges in retaining and recruiting people to look into child abuse accusations. And it's prompting calls for the legislature and the governor's office to change how these investigators are trained, overseen, and paid. Robert Knodell is the head of the Department of Social Services, which oversees the Children's Division. After this report came out, he spoke with me about its findings and what should change with the Children's Division's operations. Here's my conversation with Robert Knodell. What was your biggest takeaway from reading the findings of this committee, which really brought together a diverse group of people with a lot of expertise in child welfare?
I commissioned this report when we saw the annual, child fatality review, the annual report for 2022 that came out in the fall of 2023, and we saw that rise. And so, I made the decision in consultation with some of our partner organizations to commission the subcommittee to look a little deeper into this, and especially around the Children's Division side of things, the child welfare space that we operate in. Obviously our the child fatality efforts undertaken by our department involves all children, but obviously specifically we're the most deeply involved in the child welfare side of things. But this is such a there are many threats out there to children and their safety and their well-being and their health, but this is such a unique threat when a dose of fentanyl, perhaps the size of a speck of dust, and we've all seen that graphic with the little dot on the penny, that much can be fatal in a first dose, a first time. This is not someone shooting up or smoking something. This is this is debris, could potentially be. And so this is such a unique, it's an emerging threat, I believe. And it is so different than what we've seen historically, perhaps with other dangerous drugs or other dangers to children, that I felt like it was very important that we look for gaps in our training. We look at opportunities that we take a look backward at what has happened in our state in recent years, not necessarily to point fingers or to try to pin something on somebody, but more to see what we can do moving forward. Where are those gaps? How can we better train and equip our employees? We Children's Division, one of the things that we're very thankful for is the fact that we have staffed up significantly here recently, and we've been reducing the number of vacancies. But the trade-off that you have in that situation, because we lost a lot of employees through the pandemic and sort of the aftermath of that, is that we have a less seasoned staff. We have a lot of new employees that are perhaps new to the child welfare space, freshly out of college, et cetera, that have less experience. So, how can we enhance our training, our awareness, our assessment of risk, in a way? And, I was very heartened even earlier today, Director Missy is scheduling time, with members of this subcommittee to do the deep dive, into these situations, and really to jumpstart the effort to actually make changes that we hope will keep kids safer in the future. That's kind of what this is about. And the report to me, did confirm that with a new threat, comes new needs, and as it results in training, equipping, and, as I said before, assessing risk.
So the report said that Children's Division approach to child safety lacked essential procedures, missed warning signs, and left vulnerable children at risk. And let me be clear, we've been talking about the Children's Division for like the last 7 months. I have a
Sure.
lot of sympathy, and we'll get to this, to what investigators have had to go through over the last year with their crushing caseloads, the turnover, the backlogs, everything. I understand that. But like when I was talking with Jessica and Emily, they told me that there were cases where there was either evidence that the parents were taking fentanyl or that investigators did not do a thorough enough job looking into potential fentanyl use before a child died. And I mean, I think that an obvious reaction to that is like, how could things like that happen?
That's exactly the question that we are asking. And one of the biggest takeaways that I had from this report is that these cases do deserve a deeper dive. And are these are the and where do we see parallel incidents? Where do the teaching moments exist, so that we can make sure that that doesn't happen again? People, this is something that is relatively new. And certainly I don't think our training has yet risen to the gravity of the threat. And so that's why we commissioned the report. And that's where we want to head. But certainly given the strains and the constraints that we've had on the system, I'm just thankful that we're at a point now where we do have the bandwidth to be able to dive deeply and to address it.
One of the possibilities of to answer why is that with turnover, you comes less experienced investigators. And no matter what type of training you do, and I know that like most of the training has been online because of COVID, and I think one of
Yes.
the recommendations is to not do that anymore.
Mhm.
But you could get a lot of training, but training is not as valuable as experience. And if
Yes.
people have not encountered fentanyl use and they don't know what to look for and they don't know what to do when somebody says, "No, I'm not doing any fentanyl. What are you talking about?" And, they hit it somewhere, then like you're going to miss these things. I guess like what can we do as a state to make sure these investigators know what they're looking for and know how to do a thorough job investigating a complaint where there could be fentanyl use?
I think that's where I think that's where analytics and data really do come into play. That we have to the child welfare space is it's a constant risk evaluation. And nobody wants to remove a child from parents unless there's a very good reason to. And there are good reasons why investigators should be reluctant to do so. And so they are trying to, we understand that removing a child is traumatic, and very difficult, and probably something that a burden that child is going to have to carry emotionally, perhaps for the rest of their life. So that's a very, very difficult decision to make. And so we have to make sure that the risks that are being accounted for, being evaluated to inform that decision, that we're taking the right risks into account. And historically, you go back 5 years, 10 years, I'm not sure these were risks that were in the calculus at that time. I couldn't have told you what fentanyl was probably 6 or 7 years ago. Maybe
And
I
to be
could have.
honest with you, I mentioned this during my other reviews. I don't even know what it looks like until
Yeah.
I did it yesterday. So I understand your point,
I
but
assume by did it you mean you looked at it, you
I
didn't like
looked at it. I
do
am
it.
not a fentanyl user. Continue, sir.
That's fair. Absolutely. No, I mean, I do, so I do think it's, this is, with new threats have to come, new practices, in child welfare. And, we need to catch up to this and get ahead of it.
let's talk about like what to do when you find fentanyl, because the instances about like either the mother or the children testing positive for fentanyl, I think one of the things that could hypothetically happen in that situation is a investigator could treat that similarly if they get a call saying, and I hate to use this as an example, but I'm just going to because it fits the description. They get a call saying, "Hey, I am watching a parent beat their child with a bat. We need to get law enforcement there, and we need to get a children's division person there." That kind of falls in line with what Director Missy said about
Mhm.
reacting quickly to imminent threats to children.
Correct.
Do we need to treat fentanyl use similarly to that, where it includes alerting law enforcement, alerting juvenile officers, and we'll talk about this in a minute, trying to figure out a way to either direct that parent to drug treatment or find a temporary place where that child could be while they go through drug treatment. And we'll talk
Uh,
about tapas more specifically in the next question.
Yeah, no, that that's exactly correct. This is a grave risk to the child. Yes, it must be reacted to that way. We also, have to really, continue to be serious about building capacity in the state for treatment. Because if your answer to a question is we're going to seek treatment for this individual, if that treatment doesn't exist or there is a waiting period of time, until that individual, obviously we're not in the treatment business directly at DSS, but if that treatment does not exist, if those resources in a specific community are not there, then obviously we have to look again at that risk differently. We can't simply wash our hands and say, okay, we are going to seek treatment for this individual and we've done our part. The capacity constraints around behavioral health treatment, substance abuse in our state, have to be taken into account as well.
Now, can you just explain what a temporary alternative placement agreement is?
What it is a temporary placement for a child.
I think this is like a really solid idea, but I think that it kind of falls apart if the parents don't agree to it. Like if they don't agree to like taking their kid out of the house and giving it to a relative,
Yes.
and it falls apart. Like I think it's a well-meaning idea. I think it's a great alternative to like a juvenile officer trying to get a judge to put the kids into foster care. But I could see that entire process falling apart without the cooperation of parents. Is that
Mhm.
one of the things this committee found, that like this tool wasn't utilized enough, perhaps because like parents didn't agree to do it?
Yeah, that's one thing that you'll find, and it's actually something I would encourage you to talk to Director Missy about. Is we see great variation around the state, and our child welfare system in Missouri is broken out by judicial circuit, and often the way the juvenile officers work with children's division, the way judges approach these issues. Obviously judges are elected in certain parts of the state, appointed, the role of law enforcement, in those processes, as well, as the capacity for prevention and treatment, from community to community. When you've seen one judicial circuit, you've seen one judicial circuit, and it varies greatly. And certainly the utilization of tapas varies significantly, across the state. But we see variation in those being used. But when we can achieve a TAPA, we typically do see better outcomes.
Let's talk about juvenile officers. In Missouri, Children's Division investigators do not have the unilateral power to remove kids from a home. They have to gather evidence, turn it over to a juvenile officer, an official that's employed by the courts, and then that juvenile officer asks a judge whether to remove a child. I hate to use the word synergy because I think it's like one of the dumbest words, but like one of the things I've kind of gathered in the last 4 months is seems to be a lack of synergy between juvenile officers and children's division personnel. I'm not saying everywhere, because as you
Sure.
mentioned, it's a different situation depending on the circuit. But I've just gotten a sense like the communication is just not there right now, and it really needs to be improved uh, in situations like this. I mean, what do you think about that?
Yeah, well, I mean, one of the challenges, and again, I mean, there are areas or judicial circuits in the state, where, those relationships candidly are stronger than others. And, we have, and I'll go back to this, we have a lot of new staff. We have a lot of new circuit managers, a lot of new leadership in these communities for children's division around the state as well. You see a lot of new faces in the juvenile officer community. So, where, 5-10 years ago, you may have had children's division personnel, JOs, that have worked hand in hand for 15 years, and they sort of understand, how, each side of the system sort of functions and what people are looking for, and how, certain situations are reacted to. And, you have less seasoned personnel that don't have those long-standing relationships. It continues, and that's something Director Missy and I both stress, across the state, is investing, building those relationships. We will have a better child welfare system in the county where the relationships with the juvenile officers is strong, where the relationship is good with the judges, local law enforcement, the school districts, the healthcare community. If there's a hospital, other, DMH, et cetera. When those relationships are good, we get better outcomes because we're but one leg of the stool, and we certainly have to do our part, work well with others, and create situations where they'll work well with us.
This may be a better question for Director Missy, but since you, I guess, oversee him, I'm still going to ask you about it. So when we talked last year, he talked about triaging and that being the necessary thing to do when you're short-staffed. And I totally understand that. You can't go in and say, we are going to get to every abuse and neglect claim really quickly when you have 16 people in St. Louis. Totally understand that. But it seems like triaging has consequences. If you don't treat neglect claims as seriously as emerging abuse claims, you're going to have situations like what's in this report. And this could be seen as a consequence of triaging, even if the triaging makes a lot of sense. I guess that's more of a statement than a question, but I would like you to kind of respond to that.
Fentanyl has to be looked at, as a greater danger than perhaps other substances, just given the lethal its lethal nature. And so, I think that, one of the takeaways is simply escalating that, within, if you're in a triage situation, those, it is a rethinking from a practice standpoint, these dangers, and making sure that they're addressed, at a level commensurate, again, with the risk. And, you look at neglect situations, the risk of fentanyl, is screaming red hot, as far from where I sit.
I'm going to bring up my favorite topic, which is pay, which I'm sure
Yeah.
is your favorite topic too.
Well, it is.
I mean, it is. And I hate to be myopic about this, but I think a lot of issues with the children's division comes back to pay. $43,000, or I guess it's going to go up to 44 with the 3.2% increase, or close to 44. I know it's more than it used to be, but I still don't think it's enough to convince people to stay. And I looked at the budget bills. I don't think it's going to be going above 3.2%. Unless I'm totally reading that incorrectly.
Yeah,
So, yeah, continue.
yes, the 3% is included, both in the version that passed the House and is in, the version under consideration in the Senate. So yeah, I think that, that is where we will end up. We have made a great amount of progress on pay, but much work remains. These situations, and when we look, one of the things, you look at teacher salaries, and
Mm.
the investments that, both the state and, a lot of local school districts are trying to are trying to make, that creates pressure on children's division as well, because a number of our employees require the same education, the same degrees, that would allow them to teach in a school if they were certified. Obviously, 9 months of the year, as opposed to almost 24/7 in many cases, 365 days a year. So, I
Yeah.
think obviously we understand, and I know you've written about, the landscape that exists in some of our neighboring states. That's a
Yeah.
challenge.
I did not
But it's
know it was $70,000 in Illinois. When we talked, you said like 54. I guess they've raised it in Illinois into the 70s.
Yeah, I
I don't
think
know
I
if
got that number of 54 back in like 2021. So I'm
yeah,
sure.
I couldn't believe that. I was shocked. And again, like I'm going to try to put this as politically correct as I can. I understand what position you're in. I understand that you're part of the governor's cabinet. The governor has told me he does not really want to do, he wants to do standardized raises, and that's been his MO, which I'm sure you're very aware of, with some
Yes.
exceptions, like, corrections workers, which again, understand.
Mhm.
But again, I'm looking at this and I'm like, this is such an obvious problem. And everybody I've talked to knows it's a problem. Is it ever going to get to a point where we can elevate the critical mass to be like, yeah, $44,000 isn't enough. Let's actually do something about it collectively between the executive branch and the legislative branch? I mean, the answer
Well,
is probably yes, but I guess the question is when.
yeah, I'm gonna, I'm gonna be supportive, and and advocate for any and all increases that that are potentially in the cards for our team members. And part of what we're trying to do is change the perception of these positions, that these are not. These are not desk jobs in the traditional sense. I mean, these are in many cases first responders. These are individuals that you can be off the clock, but you're never really off the clock, because you're one phone call away from an emergency situation that you may have to deal with. And so I think looking at this differently, and trying to really reset the mindset around these positions, that that reflects the reality of the work. And we have to continue to invest in these positions. So certainly we do. And moving forward, I hope that we'll continue to see upward trajectory for children's division team members, and hopefully it's significant for sure.
Any other thing that you would like to add?
There's a lot of support, and we really appreciate our partners out there that work with us. What we're really trying to deliver is a mindset that, hey, when we see a problem, and I consider child fatalities related to fentanyl, and frankly any child fatality is these are problems that we want to rip the band-aid off, and not try to run from or try to paper over. But let's rip the band-aid off. Let's have the candid, uncomfortable conversations that will get that will get better results for the children of Missouri. And that's why we commissioned this report to begin with. And that's why I'm probably going to ask the board to reconvene that subcommittee, again, for a progress report in the near future, to see, to make sure that these recommendations, to the satisfaction not only of our team internally, but to the satisfaction of our external partners, that we are making headway in this space, that we're working together, being a good partner with others, to make sure that we're doing everything that we can to prevent these fatalities. Want to be a good partner with law enforcement as they try to interdict and fight the fentanyl trade in our state and in our country.
We'll be doing a longer, in-depth story on this report later in the month. But for now, you can read more about the Children's Division's challenges and opportunities by going to stlpr.org. I'm Jason Rosenbaum, and thank you for listening. Politically Speaking is produced by Sarah Kellogg, Rachel Lippman, and me, Jason Rosenbaum. The show is edited by Fred Ehrlich. Read all of our coverage at stlpr.org. And if you haven't already, make sure to subscribe to Politically Speaking by searching the term Politically Speaking on Apple Podcasts. From St. Louis Public Radio. This is Politically Speaking.